Hello and welcome. Today we're diving into a rare and serious congenital heart defect known as interrupted aortic arch, or IAA. This condition affects newborns and requires immediate medical intervention. We'll explore what causes it, how it impacts the heart, and the journey of diagnosis, treatment, and long-term management. The exact cause of interrupted aortic arch is complex and often multifactorial. In most cases, it's believed to arise from a combination of genetic and environmental factors during fetal development. Specific genetic mutations and chromosomal abnormalities, such as DiGeorge syndrome, have been linked to an increased risk. Maternal factors like diabetes or exposure to certain medications during pregnancy may also play a role. However, in many instances, the precise cause remains unknown. Interrupted aortic arch is characterized by a complete break or discontinuity in the aorta, the body's main artery. Normally, the aorta carries oxygen-rich blood from the heart to the rest of the body. In IA, this blood flow is severely compromised. The portion of the aorta after the interruption receives blood through the ductus arteriosus, a fetal blood vessel that usually closes shortly after birth. When the ductus arteriosus closes in a baby with IAA, blood flow to the lower body is severely reduced or cut off, leading to life-threatening complications. Interrupted aortic arch is a relatively rare congenital heart defect, affecting approximately 1 to 3 in every 100,000 live births. It accounts for less than 1% of all congenital heart defects. There is no known significant difference in prevalence based on gender or ethnicity. Because of its rarity, specialized centers are often required for optimal diagnosis and treatment. The symptoms of interrupted aortic arch typically appear within the first few days or weeks of life, as the ductus arteriosus begins to close. Affected infants may exhibit poor feeding, lethargy, rapid breathing, and signs of heart failure, such as a rapid heart rate and swelling in the extremities. A noticeable difference in blood pressure between the arms and legs is often present. The baby's skin may also appear pale or mottled due to poor circulation. These symptoms are critical indicators requiring immediate medical attention. Diagnosis of interrupted aortic arch often begins with a physical examination, where a heart murmur may be detected. However, the definitive diagnosis is typically made through imaging studies. An echocardiogram, which uses sound waves to create images of the heart, is the primary diagnostic tool. Other imaging techniques, such as a chest X-ray, CT scan, or MRI, may be used to further evaluate the anatomy of the heart and blood vessels. These tests help to confirm the diagnosis and identify any associated heart defects. Interrupted aortic arch is classified into 3 main types, based on the location of the interruption. Type A refers to an interruption distal to the left subclavian artery. Type B is an interruption between the left common carotid and left subclavian arteries. And type C is an interruption proximal to the left common carotid artery. The type of IA influences the surgical approach and potential associated anomalies. The treatment of interrupted aortic arch is almost always surgical. Initially, medical management focuses on stabilizing the infant. Prostaglandin E1 is administered to keep the ductus arteriosus open, allowing blood to flow to the lower body. Surgical repair typically involves reconnecting the interrupted segments of the aorta, creating a continuous vessel. Depending on the complexity of the case, additional procedures may be necessary to address any associated heart defects, such as a ventricular septal defect. Post-operative care includes close monitoring and medications to support heart function and prevent complications. Unfortunately, there is currently no definitive way to prevent interrupted aortic arch. However, preconception counseling and prenatal care are crucial. This includes optimizing maternal health, managing pre-existing conditions like diabetes, and avoiding exposure to known teratogens, which are substances that can cause birth defects. Genetic screening and fetal echocardiography may be recommended for families with a history of congenital heart defects. The prognosis for infants with interrupted aortic arch has significantly improved with advancements in surgical techniques and neonatal care. While long-term outcomes vary depending on the complexity of the defect and the presence of associated anomalies, many children who undergo successful surgical repair can live relatively normal lives. However, they may require ongoing follow-up with a cardiologist to monitor heart function and address any potential complications. Recent research is focused on improving surgical outcomes, minimizing long-term complications, and better understanding the genetic factors involved in interrupted aortic arch, paving the way for improved diagnosis and potential future preventative measures. Thank you for watching.